as a healthcare system, there are 6 pillars. One of them is quality, and everything is aligned, and everything flows from the top, with CEO setting up, really stretched goals for all these measures. And then everyone, sort of it goes into everyone's performance evaluation also. And then I think they're also shared, and all the successes and even failures are shared at the annual, sharp experience meeting. So I think there's a lot of transparency around those. And even in break rooms and coffee room, there are, the latest results posted. So.
Betty, any other comments?
Well, I can certainly echo my colleagues there. It's obviously a foundation of patient-centered medical home, so quality is key.
Okay, I think we have time for a few more questions. Let's go there, and then Liz. 2 more.
This question is for Dr. Adnihochi. I hope I say your name right. So you mentioned something about telemedicine, right? Telehealth to monitor blood pressure. How do you do that? Do you send providers, or who set up the telehealth at the patient's home?
I think is the question. I'm sorry, but the question about telehealth at home.
Yeah, I mean you mentioned telehealth, but
Yes,
I didn't
yes.
hear the details.
So I think we have one charge nurse, population health nurse, and her responsibility is to, when we identify the patients, we do send someone to home to activate, to show to the patients, right? I think we have had an experience before when, for a different telehealth product, we sent, just mail the devices to people's home, and we found later on that half of the time people didn't want to open their boxes. So I think, we have, this nurse who is going out, and activating those devices and encouraging. So I think that personal touch is very, very important, yes.
Okay, so we have one last question, and just to remind you, all of our panelists will here for lunch. Come to our table if you want to ask questions afterwards to them personally. Yes, Liz.
Great presentation. I was at a meeting the other day, and the American Cancer Society, who's a member, I'm Liz Helms, California Chronic Care Coalition. We have over 30 different member organizations, from providers to patient organizations, and we represent about 16 million people in the state. So the American Cancer Society is one of our members. And he came to the meeting and he says, I brought you a present. And I said, what kind of present did you bring me? And I go over and there's a packet of the American Cancer Society. Open it up. They joined as a member of the Measure Up, Pressure Down. And the whole thing was about Measure Up, Pressure Down. And I thought, wow, this is a present, because they know how much we have worked with the Right Care Initiative as a partner and how much we believe in what you're doing. So my question to you is, first, thank you, because that's going to be an awesome partner to have. As you move out into more of the consumer communities, do you see yourselves, getting more national organizations like arthritis and MS, and who really have a struggle with getting control of blood pressure and looking at the comorbidities of hypertension with the other chronic diseases?
So I'm going to have Kendra, who manages all of our partner relations, talk about that.
Sure, that's actually primarily the goal of our partnerships, is to work with those groups that are already in those spaces. What we didn't want to do is reinvent the wheel and come up with other materials and resources and tools that were already out there. So when we strategically align with these partners, we want to build off of what they're already doing and work together and share resources, because this was our first national campaign. So we started off with a very limited budget, very limited resources. So we wanted to reach those bigger groups like AHA, Million Hearts, American Cancer Society, and really work with those organizations to tap into what they're already doing and kind of spread the wealth. So that's really what when we look at partnerships, that's the primary goal in that.
Okay, very good. Thank you again, Jerry. Just terrific information, terrific presentations. I particularly related to Wisconsin. I was born and raised there. Till I was 8 years old, I managed to escape the fish fries, I think. So, I'm in the control group, so we'll see. Still counting, too. Okay, I need to give us some directions over the lunch hour, which is going to last about 50 minutes. So we have tables. And at the tables, I'm going to indicate who will be kind of the table facilitators for discussions and also the topics. So we have Parag and Reese Staley, and if you want to hear more about some of their work, they're the University of Best Practices table. Grab your lunch, which I'll tell you where it's going to be in a minute, and come to that table. Dr. DeMaria will be there as well. Then there's a table, the Kaiser, Southern California Kaiser and San Diego Kaiser. Mike Cantor and Dr. Bogani are going to be at that table as facilitators. Then Jim Duddle, I won't say Jim blank Duddle, but Dr. Duddle. Dr. Madvig here, Northern California Kaiser fixed dose medication prescribing. So if you're interested in that, they're right here at this table. And then we have Zhen Zong, Chinese Community Health Plan, at that table. We have Laura King Han, Million Hearts Campaign, and again, Admiral Simmons, Nadine will be at that table. Hector and I will be at the table over here, the research, those of you interested in research. We hope there's at least maybe a couple of closet academics that we don't want to eat lunch alone necessarily. Put in a plug. So Jerry Penso and John Cuddebuck will be at the table on data issues, so the table on data issues there. And then the pharmacists, Rebecca Cupp, Ralph's Groceries, Jan Hurst, Steve Chen, will be at the table around pharmacist issues. So those are the tables. Lunch is on the side, so go out there, grab your lunch, and then join one of these tables. I'm going to start back in about 50 minutes. Thank you.